Hello, my name is Pamela Blackwell, and I'm a United States Army veteran, as well as a current candidate for graduation from the MSW program at Savannah State University. During my matriculation in the MSW program, I have gained substantial social work skills such as empathy, active listening, self-awareness, organization, and coordination. These skills have allowed me to master some of the essential practice roles and duties of a social worker, such as counselor, mediator, broker, advocate, researcher, and most of all, community change agent. My first year internship was at Youth Challenge Academy on Fort Stewart. At this agency, my role was a counselor. As a counselor, I provided case management, mediation, group counseling, and individual counseling for the cadets. My second year internship was at the Veteran Affairs VA Outpatient Clinic in Hinesville. During this internship, my primary role was a transition and care case manager, and I was tasked with providing case management and supportive counseling for recently discharged vets that were transitioning into the VA healthcare system. I also had the opportunity to work in the primary care mental health integration clinic as well as the mental health clinic, where I was able to provide acute mental health treatment, facilitate groups, as well as long-term evidence-based treatment. My work experience at both of these internships, in addition to my courses at Savannah State University, gave me substantial experience in all 9 social work competencies. My field evaluations from both of my internship agencies illustrate my ethical and professional behavior. By receiving feedback and supervision, I have been able to significantly enhance my clinical skills as well as my ethical knowledge and professionalism. During both of my field placements, I had the opportunity to observe and conduct group therapy. The group participants come from diverse populations, such as different ethnicities, socioeconomic status, age, disability, and illnesses. I've learned that when conducting group therapy with diverse populations, you have to make sure that the content and topics are sensitive to the diversity of the group. In the midst of my MSW matriculation, I've had the opportunity to engage in 2 events that advance the social, economic, and environmental justice of various populations. The first event was the VA Stand Down. During the VA Stand Down, the social work department worked with several community agencies to feed, clean, clothe, and socialize with homeless veterans as well as the general homeless population in Savannah. The second experience was Make a Difference Day at the Second Harvest Food Bank. At the food bank, we boxed up Thanksgiving boxes for less fortunate families as well as families impacted by the hurricane. My first year research project focused on the association between parental attachment and self-esteem. This research highlighted different ways that I can engage with young adults suffering from self-esteem issues. My second year research project focused on the comorbidity of post-traumatic stress disorder and major depressive disorder. This research exposed the importance of social workers learning psychopharmacology, as well as the importance of working in an interdisciplinary team. Although I have had minimal engagement in policy practice, my experiences have been supplemental to my learning. In my policy course, I wrote a policy analysis on mandatory minimum laws. This assignment allowed me to critically analyze legislation and correlate the ways that policy can positively and negatively impact populations. I also had the opportunity to attend Advocacy Day in Atlanta, Georgia. During this event, I was able to observe panel discussions about policies as well as witness a future bill get voted in. At Youth Challenge Academy, I assisted and facilitated life skill classes. The life skills classes gave me the opportunity to build rapport with my cadets while teaching them everyday life skills that would make them productive members in society, such as how to cope with grief, managing anger and stress, healthy relationships, hygiene, and etc. While interning at the VA, I created a comprehensive guide to assist the homeless population. This guide has a list of food pantries, hot meals, shelters, shower, clothing agencies, local relief agencies, as well as national relief agencies that help homeless veterans. I created this guide for the veterans to empower them with knowledge as well as enhance their quality of life. In the role of a counselor at Youth Challenge Academy, I conducted intake assessments. The intake assessment is a biopsychosocial assessment that tells us if cadets have mental illnesses, take medications, experience trauma, taken illegal drugs, have pending legal cases, their perceived parental support, as well as their goals. This comprehensive assessment allows us to determine the potential barriers to the cadet completing the program. While working with the VA in the TCM program, I conducted screening assessments to see what the needs of the future veterans were, as well as determine the case management needs. In the mental health clinic, I had the opportunity to be a co-therapist and conduct individual sessions using cognitive processing therapy, prolonged exposure therapy, talk therapy, and couples counseling. I also had the opportunity to co-facilitate dialectical behavior therapy in a group format, as well as peer-to-peer support group for recovering substance abuse veterans. My major project at my first year internship was to create a standardized method of selecting prospect cadets for entry into the program. I built a rubric based off of all of the risk factors that I identified when conducting research on the program. I also used the program evaluation methods that I was taught during my field seminar course. In summary, my MSW experience has allowed me to create and cultivate my social work philosophy and espouse theory. I have also expanded my knowledge and experience in not only social work practice, but clinical work as well. After the completion of the MSW program, I will attend George Washington University in the fall to start my doctoral program in clinical psychology. While in this program, I will still strive to obtain my license as an LCSW. After completing this program, I hope to obtain employment within a mental health field that serves soldiers and veterans and their families suffering from mental illnesses. Thank you to the Savannah State faculty and staff that unconditionally and enthusiastically helped me achieve my goals.